If you've been doing this exercise for your sciatica, you're probably doing something really wrong. In this video, I'm going to cover the correct and safest way to do flossing exercises for the sciatic nerve for most people. Now remember that sciatic is actually a secondary complaint. It's a symptom of other types of conditions, meaning that what works for one person with this won't work for another. And so seeing your medical professional is always very helpful. And if you want some help from us, we do virtual and in-person services. We have telehealth, we're licensed in different states. You can always find our contact below. But what we find that most people end up having a problem with originally is what we call Slump Test. And so Slump Test is a really classic test that we do with people with sciatica. And it involves going down like this, and you bring this up, and you bring the foot up, and you keep the head down, and all of a sudden this position, remember this position, actually makes them feel worse. Most people. And their sciatica in this scenario is what we call it's tension intolerant. It does not tolerate stretch. And so we're stretching the sciatic nerve all the way down to the foot with the foot cocked back in combination with flexing the spine and pulling the spinal cord portion from the neck. So what this looks like is what sometimes people are doing. They're looking at their foot. If you can see your foot go up, you're doing this wrong. And what you're doing is probably tensioning the system over and over again and making your symptoms worse. Again, person dependent, because sometimes this is correct. For people who have sliding disorders, which is a whole different subset of sciatica. Now, the way I would do it if I was going to instruct the typical person is going to be, if we're doing the same side of the sciatic nerve, you can actually bring the knee really far to the chest first to take the slack out of the system. And then after that, you want to actually kind of do a little opposite from what that test is, which is going to be here. And you see how my toes are pointed? That's because I don't want a tension from that end. And you see how I'm looking, so I got that pointed, and also I'm looking up. So I'm slackening and slackening. So we're gonna shin up, head up, down and down, shin up, head up, down and down, shin up, head up, down and down. Now the mistakes that people oftentimes make, other than the one that I just mentioned, is they end up letting their leg drop. The thing about the sciatic nerve is, and other types of nerves of the body, is they really only pull if there's slack taken out. So if you imagine my shorts right here, if they're wrinkled up here, and our goal is to pull this pocket, see how when I pull this, the pocket doesn't move, but if I take the slack out, it pulls the pocket. The same thing happens here. You have to actually create tension in certain areas to be able to pull it through a point. Now, I've seen this work with people with lumbar stenosis. I've seen it work with people with foraminal stenosis and lumbar spine, or as well as central. I've seen it work with people with discogenic symptoms, but this is just only one type of method to treat it. It's not something that works for everybody. So if you guys are looking for help with this, subscribe to the remainder of our channels and check out this video that we have at the end here, because it may give you a little bit more insight about what's going on with this type of sciatica. Take care.